Good day everyone, this is Ron Pangilinan from the SM3H of Neust, and for today's video, I will demonstrate surgical hand washing. The goal of surgical hand washing is to reduce the number of microorganisms on the hands, cross-contamination, and transmission of microbes and diseases. For the equipment, check for soap, running water, and paper towels. For the implementation, nails should be kept short. Most agencies do not permit healthcare workers in direct contact with clients to have any form of artificial nails. Short nails are less likely to harbor microorganisms, scratch a client, or puncture gloves, and long nails are hard to clean. Removal of all jewelry is recommended. Microorganisms can lodge in the settings of jewelry and under rings. The next, check hands for breaks in the skin such as hangnails or cuts. These conditions increase likelihood of more microorganisms residing on skin surfaces. If you are washing your hands where the client can observe you, introduce yourself and explain to the client what you are going to do and why it is necessary. Turn on the water and adjust the flow. Regulate the temperature of the water. Warm water is recommended to prevent drying out of hands. There are 5 common types of faucet controls. First, hand-operated handles. The next, knee levers. Move these with the knee to regulate flow and temperature. Then, foot pedals. Press this with the foot to regulate flow and temperature. Elbow controls. Move these with the elbows instead of the hands. Then, infrared control. Motion in front of the sensor causes the water to start and stop flowing automatically. Wet the hands thoroughly by holding them under the running water and apply soap to the hands. Apply the soap and wash, but hold the hands higher than the elbows during this hand wash. This would ensure that water flows from the least to the most contaminated area and rinsing microorganisms into the sink. Wet the hands and forearms under the running water, letting it run from the fingertips to the elbows so that the hands become cleaner than the elbows. If the soap is liquid, apply 4 to 5 ml or 1 tablespoon without touching the bottle. Use your elbow if necessary or have someone to operate the soap bottle for you. A good amount of soap is required to create lather for a 3 to 5 minute scrub. the surgical hand washing, it is advised to use a brush with soap. Wet hands and use soap. Brush starting from palm, back of hands and forearms in circular motion. Scrubbing loosens resident bacteria that adhere to skin surfaces. Rinse the hand one at a time, starting from fingers to elbow. This step allows for all the soap to be rinsed off from cleanest to dirtiest area. After washing and rinsing, use a towel to dry one hand thoroughly in a rotating motion from the fingers to the elbow. Drying facilitates pruning, putting on of gloves. Then, use a new towel to dry the other hand and arm. Turn off the water. Use a new paper towel to grasp a hand-operated control or have someone to do it for you. Raise both hands in front of you and keep it above your elbow, ensuring that it touches nothing other than the procedure you're going to perform. This step prevents contamination of the hands and adheres to the principles of sterile technique. Then, continue with the next procedure if it is surgical gloving or gowning. Then lastly, there is no traditional evaluation of the effectiveness of the individual nurse's hand washing.